Good morning to all our lupus and fibromyalgia friends. We are here for a very special Community Connect this Friday morning. We're going to start off with some introductions, and we have a very special guest, Kelli from More Than Lupus. So we're excited to hear from her. We have some special advocacy content that we need to talk about. I'm Melissa Toller from the Support Fibromyalgia Network, and we are a nonprofit organization focused on fibromyalgia patient and medical education, advocacy, and awareness. And next up is Estella.
Hi, good morning, everyone. Happy Friday. We are here on our Community Connect Live. I am Estella Mata, one of the co-founders of Looms For Lupus, a nonprofit organization that my sisters and I founded many years ago to support those living with lupus and overlapping conditions such as fibromyalgia, their loved ones, and caregivers. So I'm excited to have our special guest here today.
Yeah, Kelli, why don't you introduce yourself?
Hi, I'm Kelli. My name is Kelli Roseta. I am the founder and also executive director of the Portland-based nonprofit More Than Lupus. And I am a 30-year lupus thriver. And with More Than Lupus, we're kind of a three-pegged stool, so to speak, of advocacy, awareness, and patient support. And I'm very, very excited to be here today.
Well, we're excited to have you because you've been posting about something very important for the most favored nation, information. And I had originally thought that this was something supposed to be good when it came to negotiation of drug prices and all that I learned. So I was surprised to hear what was happening. Can you do us a favor to our audiences and introduce what this legislation is? So what is the most favored nation model legislation? And then also, what has surprised you in the mail and got this all started?
Well, can you hear me okay? Okay, yeah. So what is the most favored nation model legislation? I'll start there, and then I'll talk about how it all got started. So the Centers for Medicare and Medicaid Services, CMS for short, right? They are set to enact the mandatory most favored nation model after the temporary restraining orders and injunctions issued by Judge Catherine Blake and the American Hospital Association, to name a few, expire this week. Now, this is a 7-year model, and it was designed, like you said, Melissa, with the hopes of lowering drug prices for the general population by lowering the reimbursements given to doctors and infusion centers and hospitals for specialized medication, including biologics. We'll talk about biologics in a second. However, the problem is, instead of holding drug companies accountable for lowering drug prices, which are significantly higher here than many parts of the world, the model, it slashes payments to hospitals and to infusers and to private practices for the drugs that they purchase for you, for me, for their patients. And unfortunately, the 50 medication, that's 50, included in the model affect primarily rheumatology and oncology patients with moderate to severe disease activity. Now, the push, this is what I call the push problem. The aim of the model is for Medicare administrators to push drug companies to lower their prices, right? The people behind this bill know that physicians, infusion centers, and hospitals won't purchase medications that they cannot afford. And their hope is the pressure that this push will have on them will force manufacturers to drop prices quickly. That's the goal. Now, the problem with this push problem is because of this new policy, doctors' offices and infusion centers across America are unsure if they will be able to cover the cost of these very important life-saving medications. These medications are used to treat lupus, RA, leukemia, lymphoma, macular degeneration, and many other serious health conditions. It's frightening to doctors across America. In fact, Dr. Thomas, who we talked to quite a bit through our various social media platforms, who's also the author of the Lupus Encyclopedia, he said it is horrible for patients. No doctor will be able to afford and administer these medications. Therefore, it is the patients who will get hurt. So your follow-up question was, how did this all get started? Why is Kelli the only one talking about this? And why is she so heated up about this all the time? Well, this all started when I received a 3-page letter from my rheumatologist's office stating that there may be an interruption with my care. Because I do monthly infusions of Benlysta, and I have other types of infusions that I've had in the past as well. And I also do weekly shots of methotrexate. So this is why I want to really encourage people who are listening right now not to tune out, because they think if they don't have Medicare or Medicaid that this won't affect them. Here's the deal. Here's why we all need to listen up. Well, there's 2 things, okay? Number 1, first, it's my firm belief that if something affects one portion of the autoimmune community, it affects us all. We are a family. And family supports and stands up and fights for each other. People tend to believe that the sky isn't falling until a chunk of it falls on them. And it's true about this model. It's true about COVID. It's true about chronic illness in general. But that is just plain wrong. We have to fight for each other. Because one day you might need help, and we will be there to fight for you too. And you don't want to look back and say, I could have done the right thing, but I didn't. And the other point that I want to make, sorry, I'm talking fast because I know we have a lot to cover, is the snowball effect that all of this is going to have, the effect of this model, the negative impact it will have on the sustainability of our doctor's offices, our infusion centers, and our hospitals. This could eventually affect us all. Doctors are concerned. I've heard from so many different doctors across the nation because all the money that they're going to lose from this model will eventually affect the sustainability of their practices. They'll have to cut back on staff, on hours of operation. And that affects anyone treated at these facilities, regardless of your insurance and regardless if you're on Medicaid or Medicare.
I am so excited that, you have taken this, your initiative to inform everyone, because not everyone will be receiving the letters that you received for you to take action and know and be aware. There are so many rheumatologists that are we're already short-staffed with rheumatologists, first of all. The second thing is rheumatologists run very small practices. They sometimes can't even keep up with all these changes and or send letters out to their patients like they did with you. So what happens is these providers are not only losing money, they can't provide the care to the patients that need that care. And then the patients that need that care are the ones that are going to end up suffering, like you just stated. So it is very important, and it's so interesting that you say how right now it is going to impact the autoimmune community or those that are taking these infusions. However, when I just looked at it, and I was trying to look for it right now, there was a tweet that was sharing information about the increase of Medi-Cal and Medicare lives just this past quarter. So many people don't have jobs and are going to be getting these types of insurances. And what happens is it is going to impact a lot more people than what we can imagine. And infusion centers will probably be the ones that are first aware of this, because that's probably all they do. But the rheumatologist office are the ones that I'm very concerned about, and overall the patients. So I thank you for taking your platform and informing everyone like you do when you share your information. And everyone needs to be aware of this, because we all know someone or love someone that may be getting infusions. And at the end of the day, the patient's the one that loses all the time. And I don't understand why these things happen, but we do know that we have a voice, and we need to amplify our patient's voice, and we need to stand up, and we need to send out the letter that you shared with us, and maybe we can share it with whoever's interested, a letter that you can send out to your legislators so they know that this is something that you care about. You as a constituent need to get a hold of them, let them know the importance and how it is going to affect not only you if you are taking infusions, or a loved one or a friend of yours. Like in my case, I don't get any infusions. My sister doesn't either. But that doesn't mean that I'm not going to amplify my voice and use my voice to help others. So we can all do something about this.
And it's so important, and I'm so glad you brought this up in different ways, because I know your community, you've heard from other people that they've actually gotten letters. So you weren't the only one postponing treatment in January. So it's created a lot of confusion among patients and providers, correct?
Yes, absolutely. I've heard things across the board. I've heard that patients have already had their infusions canceled for January. I've also heard that most patients have no idea what this is all about. And luckily, like Estella said, my doctor's office is truthful and upfront about it, and encouraged all their patients to reach out and write their congressmen and women and representatives about it. But I think the sad part is most of the larger NPOs unfortunately aren't talking about it. I can only assume it has to do with pharma, and I'll just leave it at that. But it's up to us. It's up to us patient advocates to get the job done. And that's why we're here talking about this, and why we continue to talk about the hard stuff. I also would like to kind of clarify, a lot of patients, there's confusion about who this affects first, what the common medications are that will be affected by this model. So I just want to give a real quick breakdown for those that are watching right now who may be wondering. So participation in the model, the most favored nation model, is mandatory for Medicare participating providers. So anyone, any infusion center, hospital, surgical center, private practice that participates in receiving Medicare patients, and suppliers that submit a claim for a drug, and anyone who's a Medicare beneficiary. So someone that is on Medicare or Medicaid. This includes, like I said, providers and suppliers. Now, as I mentioned earlier, there are 50 medications on this list, right? And the medications are used to treat rheumatological and oncology conditions like lupus and RA, and a lot of lupus overlap illnesses like scleroderma, mixed connective tissue disease, dermatomyositis. And the medications that we are most concerned about on this model include Rituxan, which is a big drug for us lupus patients with moderate to severe disease activity. Actemtra, Simiza, Orenica is another big one. Simponi, Aria is a big one. Prolia is a scary one, and Orthovisc. Now, there are many medications to be concerned about on the list. Prolia, for instance, which is used to treat osteoporosis. And a lot of people who have been on chronic steroids develop osteoporosis. This is especially worrisome in the rheumatic conditions category, because if a patient is not able to access this medication because of this model, they can develop rapid bone loss within 1 to 2 months of being without the drug. And they'd be at risk for multiple fractures. And if you think about it, if you have the unfortunate circumstance of managing lupus and RA, and you have a cancer diagnosis, you are in for triple the trouble. Many of the biologics on the list are used to treat various forms of cancer as well, including lymphoma and leukemia. So there's a lot to be concerned about.
It definitely is confusing, and the more I dug in, the less I could figure out what was going on. And just trying to dig in too to understand where the legislation is at, because I did find stuff from CSRO and their advocacy. So they have a letter and a forum for rheumatologists on their website. But I was really trying to see like the different things and how it really affect the patient, so we could put that together. Do you mind sharing with us some updates on legislation? I know I saw there was temporary restraining order, and there's open to comments, which we'll share the commenting form for the federal legislation, and I'll put that in the comments. But where are we with legislation?
That is a very good question, and I'm sure a lot of people who are watching this are going to want to know. So here are the updates. The model was supposed to become effective on January 1st. However, like I mentioned earlier, there was a temporary restraining order that was placed by U.S. Court Judge Catherine Blake a few days before Christmas. Now, these temporary restraining orders only last 14 days. It expired this week. In addition to that, multiple lawsuits and injunctions have been filed, including a big one from the American Hospital Association, because they're really, really scared about this bill. In fact, this is what they had to say about it. Hospitals and health systems have very deep concerns about the substance and legality of this model. And the American Hospital Association filed a declaration with this lawsuit expressing how the model could negatively impact hospitals, healthcare systems, and the patients they care for. And that was the vice president of the AHA, Tom Nichols. Now, because we were talking about this before we went live, because of the coverage with the Capitol breach yesterday, the transition of power, or 2 days ago, COVID cases, it's very difficult to get any sort of updates on this model this week. But I've heard some murmurings from doctors across the US. In fact, one doctor, Dr. Thomas, sent me a comment this morning saying that they're hearing that it may be delayed for 60 days. And their hope is that 60-day delay will help when President-elect Biden comes into office, and he and his staff will eventually attempt to throw this bill out, this model out. I will keep you abreast of any changes. Also, between the lawsuits and the injunctions, I would imagine there being somewhat of a stall the next few weeks anyway. But like I said earlier, we are already seeing the impact, and patients are already saying that their care has been interrupted due to the doctor's offices being concerned about the financial impact of this bill. That's why, even though we're hearing these murmurings of there being a hold put on it, we still need to have our voices heard. We have to continue to write our congressmen and women, our local representatives, about this issue. They need to know how not having access to your life-saving medications is going to affect you. It's just like the Plaquenil issue last year. It is so important. We cannot continue to hurt one population in order to help another. Enough is enough in the autoimmune and lupus community.
Kelli, so even though we might be waiting for 60 days, or it'll be on hold for 60 days, meanwhile, that's 2 months. That means January and February, people like you that get these infusions are not going to be getting your treatment. Not only that, most of the providers are going to be conservative in even administering or having the patients come in. So where does that leave this whole adherence of medication or treatment? Where does that leave the quality of care for the individual that needs this care? Not only that, one more thing, you can die. If you have a major lupus flare and it attacks a vital organ and you die, who is going to be responsible for all of this? Like, I cannot believe that a lot of people are staying quiet when we have this community just looking at only lupus, the lupus community. Who's talking about this? No one, except for you and our small, nonprofits like us that are talking about this. And, I am baffled. I'm upset. So I'm refraining from saying a lot of things that I wish I could say. but it's just so upsetting to see what's going on and how staying quiet is not a good thing to do at this moment. We didn't stay quiet when the Plaquenil issue was happening. We spoke out. Not everyone did. Everyone else took their time. Now with this, how many lives are going to be lost? Who's going to take responsibility? I will be able to hold my head up high with you and say, we tried to do something. What is everyone else going to do? It is just upsetting. That's why I'm staying quiet. And you guys know I don't always stay quiet, but it's better to stay quiet sometimes.
Well, MLK said the time is always right to do what is right. And I feel like as patient advocates who are given these platforms with Support Fibro and Looms and with More Than Lupus, it's our responsibility. We are charged with the responsibility of being the voice for hundreds of thousands of people every day. And whether this directly affects my care or it doesn't, to me, that's a moot point, because I am responsible for upholding the integrity of the patient community and speaking on their behalf if they cannot speak for themselves. Additionally, I almost feel that it would be negligent not to when we are given this position of power. Yeah, we are patient-driven, patient-focused nonprofits. Our priorities are very different. The way we handle our nonprofits are very different than the larger nonprofits that are not patient-driven. So it's funny because we may not be as big or as well known, but we are charged with a lot of responsibility, and I do not take that lightly. And for the last 2 weeks, I have felt like I've been fighting an uphill battle alone. So I'm so incredibly thankful to the support of Looms for Lupus and Support Fibro for helping me shine a light on this issue. Because, like I said earlier, we can't continue to hurt one population to help another. It's unethical and it's un-American, in my opinion. We need to continue, of course, to fight for lower drug prices, of course, but not this way, because the patients are going to suffer. We don't know when, we don't know exactly how. Our hope is that this whole thing gets thrown out, but we don't have that guarantee. So until such time that we see that in writing, and our doctors are not sending us letters anymore, and no one's getting calls to reschedule their infusions, we cannot stop talking. We must fight, because we don't know. We don't know how this is going to affect our family, our community.
Well, and we encourage other advocates to get involved, because this is us united, and we mobilize the other patient advocates, because this is affecting, like I saw when you did your first video, people were leaving comments that their treatments had gone postponed. They didn't understand what was going on. So we're right here with all the patients and being utilized much more appropriately to mobilize and leave those comments. So I definitely support all the work. I don't even know to the extent of how it is affecting our communities completely. I mean, I'm hearing from lupus. I don't know if fibromyalgia or even chronic pain, or we don't know yet too if people with like long haulers for COVID, ME/CFS, like all of that as well. So it's only touching on a little bit of that. So thank you for bringing this to our attention.
Yeah, I think about the number one trigger for fibro, the number one trigger for lupus, and a lot of lupus overlap illnesses is stress. When you receive a letter from your doctor's office saying that there may be an interruption with your care, or if you know for sure that you are on Medicaid or Medicare, and you will be the first population to be affected by this model, your stress level goes through the roof, and that is detrimental to your health. So that alone is something to be very considerate about and mindful of.
Well, it's a big part of it, stress. And I know we have some people checking in really quick. So let's just say hi to Laura and Jazz Cat Christopher from Australia. He was asking what's going on. So he can watch. This will be streamed, it'll be on our network, so you can always do a playback. But I know he's from South Australia, so I don't think that this is affecting him at this point. This is our healthcare system over here in the US. So, but welcome to our Community Connect Live and our discussion with special guest Kelli from More Than Lupus. And we are going over the most favored nation model legislation and giving updates on what is happening today. So thank you, Kelli. I guess it was just more of an important point. I know that you can leave comments online, and then you're working on a letter that we can use as patients to send out. Where will we be able to get access to that letter?
Absolutely. We have a letter that is all ready for you, and all you have to do is insert the name of your local constituent in that letter and your name, if you so choose to write your name, or maybe you can even do it anonymously. And we have it available through More Than Lupus, and I also can email it to Melissa at Support Fibro and Estella, and they can disperse it to anyone that's interested in sending that letter to your local congressman and congresswoman.
Okay, we'll have to add that to our blog post as well.
Yes, and I encourage you, even though, again, you are not going to be impacted personally by these infusions, I think, you still have a voice and you can help us out. So it is important to elevate our voice and use it to help others. For myself, tomorrow we have our support group, so I will be talking about this. So I appreciate any information that you can send over to me, Kelli, any handouts that I can provide. The letter, obviously, I will make sure that I disperse that, because it's something that, again, it is so important. It is going to kill people. And I don't understand, again, why this is happening. So I'm just hopeful that our voice can reach high up to the legislators. We know that they do listen to us. As constituents, we have the right to go to them and ask them for their assistance in these issues. So, I'm for sure going to be reaching out to our congresswoman, to our assemblywoman, to our state senate, and hopefully we get our voices heard.
Well, and I'd just like to invite other organizations. I know that we've connected with a lot of them from the lupus community and stuff. I mean, Male Lupus Warriors, I know I've connected with Dion. So just invite them to join if you guys have questions. We would really appreciate the support that Kelli has organized, and we'll post a blog on Support Fibromyalgia. We'll share it with other people, and just invite us to all if we need to have a separate conversation, obviously not streamed live. As advocates, I encourage us all to come together and make these decisions and talk about it, have these discussions. And really, if you have questions, if you've never reached out to your representatives before, we'll be happy to share with you how that's done. Before we leave too, I wanted to just quickly share, because you can leave comments online. Writing letters and doing calls to representatives is very effective. But I'm going to share in the discussion post where you can leave a link, and just quickly go and do a screen share. So this is the most favored nations model of a screenshot, and I know you can just quickly submit a formal comment right over here, and it'll load the comment form, and you're able to put your comments there. And you can do that. Just wanted to ask Kelli and Estella specifically, is there any recommendations you have for how they should leave their comment?
Yes, I think it is very important for them specifically to say how not having access to these medications on this 50 medication list will affect your health. They need to know specifics.
Kelli, is there any way you can maybe post a comment a recommended comment as to how they can fill it out, or what they can say? I know the letter is too long for them to add to this comment, but just the verbiage you just indicated for them.
Yes, absolutely. Absolutely. And I understand, this is probably the hardest I know for me personally, I don't want to speak for everyone, running a nonprofit, the advocacy portion of this is the hardest part because you have to sometimes ruffle feathers. You have to be bold. And I'm not a ruffle feather kind of a gal. I'm a people pleaser. I want everyone to be friends, you know, all of that. But at the end of the day, to everyone that's watching now or that's going to stream this later, you can choose courage or you can choose comfort, but you cannot choose both. And these are issues that are going to directly, in some form or another, if this model goes through, the hope is that it will be thrown out, but if it goes through, will affect your mothers, your fathers, your grandfathers, your sisters eventually, your best friends, and anyone who either knows someone living with lupus, RA, cancer, or you are that person. So it's time to act now.
Well, I'm happy to be helpful in the instigating and going against the grain for our community of patients, because for me, it's important that patients get this information, they get the education, we don't keep them in the dark. I've always believed that, so happy to support. I know sometimes we get questions here at Support Fibro, why are we doing this kind of stuff when it doesn't necessarily affect fibromyalgia, but like you mentioned, it does. It affects all of our patient communities. There's so much overlap within autoimmune conditions, and we need to work together. So happy to support these efforts and be an instigator however I need to be.
Yeah, thank you so much. Yeah, I think it's 60% of those that have lupus have fibromyalgia overlap. So, you know, we are all connected. We are all interwoven into a giant family, and we need to take care of our family right now.
Yes, we are in this together. And I think united, we can have a louder voice.
Well, I appreciate this conversation. Are there any closing remarks before we close out our Community Connect?
Well, for me, I just wanted to make the quick announcements. We have the support group, virtual support group tomorrow at 9:30 a.m. That's the bilingual or English, mainly English support group via Zoom. So please let us know if you want the Zoom information. We also have the Spanish support group at 8 a.m. Via Facebook Live with my sister and I. So we will definitely be talking about this topic. Also want to encourage, you know, other organizations, local organizations here like the House Foundation, We Win, to kind of step up, join us. We're small, but we're mighty. And I know that, again, together we can make things happen. So I encourage everyone to please join us and hop on board, because we need to do this together.
Absolutely. Thank you so much for having me, ladies. I surely appreciate it. And yeah, let's continue the good fight.
Thank you so much, Kelly. I included a link in our discussion to More Than Lupus website, and we look forward to working with you on the creating some momentum for this advocacy and good results. So please get involved. Please reach out to Kelly, everyone. Thank you so much for joining us this morning, Friday, and have a great weekend, everyone. Bye.